Good afternoon, everyone. Thank you for joining us today for a webinar sponsored by Accorda Therapeutics, part of National Disability Institute's MS Financial Wellness webinar series, Social Security Disability Benefits, Informed Decision Making. My name is Elizabeth Jennings. I'm going to be your moderator today. Before we get started, I'd like to invite my colleague, Nakia Matthews, to offer you a few housekeeping tips.
Good afternoon. Thank you, Elizabeth. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, and if you accidentally close this panel or if the sound stops, you can rejoin by going to the top menu, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number you see here and enter the meeting code. You do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you'd like to make the Media Viewer panel larger, you can minimize some of the other panels like Chat or Q&A. And conversely, if you do not need the captions, you can minimize the Media Viewer panel. We will have a question and answer portion, at the end of the webinar. Please use the chat box or the Q&A box to send any questions that you may have during the course of the webinar to Elizabeth Jennings or to me, Nakia Matthews, and we will direct those questions accordingly. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing them directly to Elizabeth at ejennings@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website at realeconomicimpact.org/financial wellness. If you experience any technical difficulties during the webinar, please use the chat box to send me, Nakia Matthews, a message, or you may also email me at nmatthews@ndi-inc.org.
Thank you so much, Nakia. And welcome again, everyone. As I mentioned, my name is Elizabeth Jennings. I'm the Deputy Director of National Disability Institute, and I will be your moderator today. We're very excited to have so many people on the line. We have a few hundred folks on the line today. We'll just take a moment to go over the agenda. Today we're going to start you off with some information on financial wellness and individuals with MS, and then I'll hand it off to my colleague, Kevin Nickerson, who will provide you information on qualifying for Social Security Disability Insurance, which we'll refer to as SSDI, the impact of work on SSDI benefits, where to turn for assistance. We're going to try to leave lots of room for question and answers, but we also are going to provide you with some suggested next steps and wrap up for those of you on the line that are utilizing today's webinar as a launching point for making a decision about returning to work. Since we do have a few hundred folks on the line, I really encourage you to put your questions in the chat box as we move through today's slides. We're not going to be able to address personal or specific questions to your personal benefits. So if you have a question of that nature, please be sure to reach out to us after today's webinar. You'll receive my email address and Kevin Nickerson's email address again at the end of the presentation. Before we really launch, I want to say a special thank you again to our sponsor, Accorda Therapeutics, who has been sponsoring the MS Financial Wellness webinar series for the past few years. We appreciate your generous support of this program. For those of you who are new to National Disability Institute, we are a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for all Americans with disabilities. We like to do the Financial Wellness webinar series because we believe financial wellness to be at the center of a person's overall wellness. We define financial wellness as the state of a person's finances with the intent of working towards financial behaviors that limit stress and the impact of stress on one's daily life. And those of you in the audience who are living with MS know how impactful stress can be on your overall wellness. There are many components to financial wellness. There's being financially literate, accessing affordable financial services, so making sure you're getting the best for your banking, utilizing favorable tax provisions, budgeting, understanding public benefit rules, which we'll be talking about today, building and maintaining assets, accessing available health care subsidies, and understanding work and long-term disability options, which we'll also address somewhat today. We focus on individuals with MS and the disability community at large because of the deep disparity there is within those communities in relation to income and poverty. So for individuals of working age, those without disabilities over the past 12 months experienced about 11.9% rate of poverty. So about almost 12% of that population were individuals who are living below the poverty level. For individuals with disabilities, that rate was almost 3 times as high. So the 2012 American Community Survey shows that 30.9% of people with disabilities had income below the poverty level. It's a huge gap and one that we take very seriously. Many of you know that for millions of working age adults with disabilities, seeking out public benefits and utilizing them can be imperative as a safety net for ensuring that the individual has the proper health needs met and also has access to meet their basic needs. However, for many folks, including many of us on the line today, that dependence can become a trap, requiring you to stay poor in order to stay eligible. And we hope that one of the things you learn today is that you leave with a better idea of how your Social Security disability benefits work and the room that you have to earn money and to save money. The majority of our work and our intense focus on poverty comes from the Americans with Disabilities Act. For those of you who haven't looked at it in a while, we had our 24th anniversary this year, and the Act states that the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. And that's really the key that we're going to talk about today, how we can assure we're all achieving economic self-sufficiency. So just to get back to financial wellness, as we noted, this is really important. It impacts mental and physical health. It positively impacts self-concept. It changes your status with other community stakeholders and can directly impact quality of life. Before we launched the MS Financial Wellness webinar series a few years ago, we did a survey of individuals with MS to learn more about their income and assets and their banking behaviors. And we learned a lot. We found that over half of the households that responded to the survey earned less than $35,000 annually, and about 16.4% earned less than $50,000 but more than $35,000. When asked about ability to pay all of your bills in a typical month, 32% reported that they had a very difficult time, and almost 50% reported a somewhat difficult time. And over 40% reported that their financial status has affected their ability to access medical care at some point. We additionally learned that over 70% of respondents do not have enough savings to cover 3 months' expenses, which is a key sign of whether you have financial stability. Over 67% reported that their finances were worse since their MS diagnosis, and over 73% reported that they were not aware of or had not used financial stability programs such as the Earned Income Tax Credit, individual development accounts, family self-sufficiency programs, and Social Security's plan to achieve self-support. And we're going to talk about some of these in future webinars. There are many financial wellness strategies that we're going to be speaking to you about over the course of the series. We gave you a little visual of them here. Today we're going to be focused on making sure that you understand some of the work incentives that are available to you through the Social Security Administration. And in the bottom box, we're going to tackle how you connect with work incentive planning and assistance programs, as well as protection and advocacy programs. If any of the financial wellness strategies that we've put forward are of interest to you and you've not yet heard about them or want to learn more, again, please be sure to shoot us an email we'll be happy to provide you with that information, and it's likely that it's a topic that we're going to address during the series or that we've addressed previously, and we could link you to an archive. So I'm very excited to hand this over to my colleague and friend, Kevin Nickerson. Kevin's a manager of financial empowerment and employment here at National Disability Institute. He's a well-revered content knowledge expert on Social Security disability benefits. And I'm sorry, I know folks hate the use of that term expert, but in the case of Kevin, he really has phenomenal knowledge, more than a decade of time providing benefit planning services to individuals who receive Social Security disability benefits, and some great success in supporting individuals to leave the role successfully at their own pace. So I want to welcome you, Kevin, and thank you so much for providing the training today.
Well, thank you, Elizabeth. That was a warm welcome, and I do appreciate it. And while I would like to say it was only 1 decade, because that changes my age a bit, I've actually, as I was thinking about this today, it was, it's really been the highlight of my career, I think, over the last 2 decades of service to folks that receive Social Security benefits, to work individually, one person at a time, to help people understand their individual benefits and work incentives that we can inject to really help them on this journey back to work or to work for the first time. So with that in mind, today I really put together the training in a way that addresses folks on the line that I think are probably here wondering if now is the time that they should consider the return to work. There's a lot of information. In fact, it's so much I hope we can get through it today. It was very ambitious of us. So I'm going to move right along and start with what these systems are. And disability, Social Security disability benefits come in really a few flavors, but 2 that we'll talk about today are Social Security Disability Insurance. These are the 2 main programs that Social Security operates, and Supplemental Security Income. And again, because they are so complex and have so much breadth in each of these in terms of work incentives available to you, today we've really decided to focus on SSDI benefits and work incentives, although at the end of the webinar today we have provided resources for folks that receive SSI as well. Based on the large number of folks that are on the line today, it's apparent to us that many people with disabilities who receive either SSDI or SSI want to return to work or work for the first time, but they're unsure what will happen to their benefits when they do. Or certainly, often we find that folks are misinformed about the impact of work and earnings. It does seem like a very large mystery to many. SSA policy includes work incentives that make it possible for folks to test their ability to work and continue to receive some or all of their cash and health insurance benefits. This is often a huge concern of folks when they return to work, that health insurance will end. We're going to show you how work incentives, in fact, impact your ability to continue to receive cash benefits, and we'll show you how you can maintain health insurance. And again, I wanted to point out today that throughout the webinar, we will encourage you to connect with a certified work incentive counselor because of their in-depth knowledge of the complex systems we'll talk about today, disability benefits and work incentives. So we thought we should start today with how people actually get benefits. So in terms of Social Security eligibility, we want to review a few steps that have to be in place for folks to actually be eligible for this benefit. And the first is that individuals have to prove the following 2 pieces to be eligible. They have to prove they have a documented medical disability that will last 12 months, has lasted 12 months, and or may result in death. So it may not be that it's lasted, that you have a condition that's lasted yet 12 months, but it's expected that it will based on your doctor's opinions. The second piece is the definition of disability itself, and this is right from Social Security. The way they define disability is the inability to engage in substantial gainful activity. SGA is actually paid work by reason of any documented medical impairment, physical or mental, that will last 12 months or longer and or result in death. So obviously this is very significant. So what these things really speak to are something Social Security calls the duration test, meaning it has to be, again, that condition that has lasted 12 months already or is expected to last at least 12 months or more and or result in death. This also speaks to the severity test, meaning that it isn't just that you have had this condition for a period of time, but the severity test, meaning that it's because of this disabling condition that you're not able to earn a certain amount of money, and that certain amount is we referenced as SGA. We'll talk more about that, but that's really the test that Social Security looks at. The last point here that you should be aware of is that individuals who are blind do not have to prove they're unable to work. They only have to prove they meet SSA's level of blindness. There's more to this puzzle, though, unfortunately. We talked a little bit about SGA. SGA is this basic test, and we're going to talk about that a lot today, that Social Security uses to establish not only if you're eligible for benefits, but if you're eligible for continued eligibility after you are approved for benefits. And we're going to talk about both sides of the fence here. But SGA is the performance of, again, significant mental and or physical duties for profit, so working. It's usually determined to be gross earnings before taxes of a set amount, which we're going to talk about here now, of money, which is indexed yearly based on the National Average Wage Index. So to meet this test, the person, when they're applying, must not be working, or if you are working, earning less than this established SGA amount. And right below on the slide here, you can see that for this year, the SGA amount for non-blind applications is $1,070 per month versus individuals who qualify based on blindness, which for this year is $1,800 per month. So now we've discussed two eligibility basic criteria. It's the duration and severity, right? How long has this lasted, and is the disability severe enough to prevent you from earning that minimum level of income, right, that Social Security calls SGA. And now that we've defined SGA and know what that is, we know that this is how Social Security evaluates claims to see if this prevents you from working at that level. But there's more. In terms of eligibility, for disability specifically, there is a requirement of FICA contributions. And if anybody knows what that is, just type that in the chat. I'm curious if folks know what FICA contributions are. We all pay them, but often we don't really, take a second thought or look at that carefully. But FICA contributions, or what we'll call credits or of coverage, are required in order to have what Social Security calls insured status. So the number of credits that you need will vary based on your age, but generally, as a rule of thumb, one would need to have about 20 quarters or credits of coverage within the last 10 years prior to becoming disabled and applying for benefits. This means that Social Security does look at recent work. Now, another note that you should be aware of is recent work isn't necessary for individuals who have a primary disability of blindness, as Social Security will look at lifetime credits of coverage to establish their insured status. And I don't know if anybody was brave enough to put that in the chat. I don't see anything there, but FICA, or the Federal Insurance Contributions Act, was actually enacted in 1935 as a tax provision of the Social Security Act, for you trivia buffs. There are other ways to become eligible for disability. Another way one can become entitled is based on, for disability benefits, based through a parent's work history, actually. Today, this is called Children's Disability Benefits, but we kept DAC here because it's been known as DAC for so long, Disabled Adult Children's Benefits. This is another way that you can actually become eligible. If you meet these criteria, the disability has to occur prior to age 22, which has to be documented. The person must not be legally married, or if they are, not married to a non-Title II beneficiary. They themselves might not have sufficient FICA credits of coverage, or a parent's record may allow for a higher benefit amount. And last and most important, the parent must be retired, disabled, or deceased. So this is one way that our taxes and contributions work for not only us, but for our family members, potentially, if needed. In terms of other eligibility pieces, medical insurance attached to disability is Medicare, not Medicaid, Medicare. The things you should be aware of about this is that there is a 24-month waiting period upon eligibility for your first monthly cash benefit. So that's when the clock starts ticking. The first month that you become eligible for cash benefits, a 24-month clock will begin, after which you will become eligible for Medicare. You'll certainly be eligible for Part A, hospitalization, and Part B and D will have a premium, but you'll also be eligible for that. Other pieces that are important for you to understand about eligibility is that there is a 5-month waiting period for your cash benefits to start. So once you've been approved, there is still this 5-month waiting period from the established date of onset. Now, Social Security, again, does pay close attention to the SGA rule during the eligibility period, meaning, remember, we talked about how much that was, and if you're working during the application, it has to be below SGA. And they also look at this ongoing after eligibility. We're going to focus mostly on that side of the fence today, about how does Social Security look at this SGA rule when you return to work. Now, I'm sure that's a question on most people's mind today. Another important fact we want to put in front of you for disability, and we will do this more than once because this is critical for you to know, is that there is no asset limit for folks who receive Social Security disability insurance benefits. Why is that? This is not a needs-based benefit. This is an entitlement benefit based on your own personal work history. Again, going back to those credits of coverage and your contributions to FICA. So you could have $1 million in the bank and still be potentially eligible for disability, as long as you have that insured status. So other pieces that you should be aware of when you do become eligible is that Social Security is required to periodically determine whether you as a beneficiary should continue to be eligible for cash benefits through a process called a continuing disability review process. Under these CDRs, as I'll call them, Social Security looks at whether medical improvement has occurred. So generally, again, once individuals are receiving benefits, this is after you start receiving benefits, there has to be substantial evidence that shows that medical improvement related to your ability to work and perform that SGA level work, remember, that 1070 or 1800, has occurred. So it isn't status quo. It actually has to show that medical improvement has occurred. This is developed by Social Security, or it must be developed before they can make any determination to terminate benefits. So before there was any termination, this is one way that benefits could stop. Now, CDRs are established based on the severity of your disability, and generally they'll occur every 1, 3, 5, or 7-year increments. Again, it's going to be based on the severity of your disability. This will be established by the continuing disability service that Social Security works with. For example, if someone has a back injury and it's likely that there might be improvement, that person's review cycle is going to be much more frequent, probably yearly, compared to somebody who has a condition that's not expected to improve at all, or improvement will be slow. CDRs can actually be suspended when using the Ticket to Work program or state VR, which we will also discuss later. Lastly, I think things you should know about CDRs is that they involve interviews both at the local office and filling out those wonderful lengthy forms, very similar to the initial application process, that collects information about your medical situation. Social Security, once they have this evidence, will then forward this to the Disability Determination Service, which again they contract in each state to handle this portion of your claim. So that's the CDR process. I'm sure folks have heard about this. So there's additional important points we want to point to before we get to the work incentives, and that is, again, Social Security really does always watch your work activity, and they continually monitor whether you're at SGA level performance or not. This SGA rule, in my mind, is sort of like Social Security's barometer of your ability to financially care for yourself. While the number is not high, and one could argue that if you made even that amount, it's really not enough. It still is the established amount that we have to work with based on your continued eligibility. Second, as you work and earn, SGA, Social Security will review your work effort, and they will take a person off the rolls potentially if they show a pattern of being able to work and earn that substantial gainful activity level of earnings ongoing. However, I want to make a point that we will discuss some work incentives with you today, which does impact the way Social Security looks at your earnings and therefore how they make SGA determinations. So nothing is ever cut and dried with Social Security benefits. Last, again, an important point, there is no asset limit. Disability is an entitlement benefit, and again, it's based on those earnings that you've had personally and your contributions to FICA. Therefore, there's no need for an asset limit for this program. I'd like to discuss this chart with you today, which highlights an important policy, not to confuse you because this does look kind of confusing, but to be sure folks understand how important the timing of work activity can be during the year after disability onset, and especially during that 5-month waiting period that we discussed. This really highlights a ruling called the Barnhart versus Walton decision. This is a Supreme Court decision that impacts when work incentives become available for newly eligible SSDI beneficiaries. Again, it's not my intent to review all of these pieces with you today, but I think individuals should understand that when you return to gainful employment within the first 12 months and before a final favorable decision has been made on your case, it can create issues with both eligibility and availability of certain work incentives. So I guess I'm showing you this because I hope that this chart will also make the case for, again, connecting with that certified work incentive counselor in your area, which we will show you how to do before the end of today's webinar. There's also a link here which you'll be able to access to review this more carefully. There certainly are a number of work incentives available to assist individuals in the return to work for both SSDI and SSI recipients. Unfortunately, it's often the case that individuals are not aware of the work incentives available to them or how to best leverage these work incentives. So this chart shows a number of incentives, and as you can see, there are many. Due to the short time today, we'll focus on a few SSDI work incentives we think are really the foundational knowledge that you should have on this next slide. We hope to get through today. What is this trial work period that you've probably heard of, and how can you use it effectively? What's an extended period of eligibility? What are impairment-related work expenses? Special conditions and subsidies? Extended Medicare coverage? And something I think is very significant in recent years is an expedited reinstatement of benefits for folks who do try to go to work and things don't go quite as planned. So we really have to start with the basics. This is kind of the foundation of the work incentive package provided to all disability beneficiaries, SSDI beneficiaries. So once you're determined to be eligible, you will be entitled to a 9-month trial work period to test your work skills while you maintain all of your monthly cash benefits. During this trial work period, benefits will continue regardless of the amount of money that you earn. So that's pretty exciting if you're considering today that maybe you will try this. The 9 months of trial work do not need to be earned in a row. So when do these count? Well, they're counted when an individual earns a specific amount of income, which we showed you on the chart before. So for this year, the trial work period amount is $770 per month, so it's fairly simple. 2 things have to occur. 1, you have to be working, and 2, you have to be earning more than that for Social Security to say you've used some of these months. So when a person has accumulated all 9 of these trial work period months within a 60-month period of time, that will end your trial work period and begin something Social Security calls an extended period of eligibility. I'm going to say that one more time. If and when you accumulate all 9 trial work period months within a 60-month rolling window of time, that will conclude your trial work period, and the next month will begin your extended period of eligibility, which we will describe to you further. So to summarize, the trial work period provides an opportunity for beneficiaries to try working again or start working for the first time. Actually, in this case, it would be to try working again for disability, but with no penalties. This is a work incentive that I would recommend using carefully, though, to help you determine if you're able to work full-time, if that's your goal. And it may not be. So to be clear, I'm simply saying it would be wise to use these months to full effect and earn as much as possible during this period to really test your abilities. For example, if you were to earn $775 a month, it certainly would use one of these months, but not necessarily tell you if it's your goal, how would I do if I worked full-time? Because that's probably an indicator of somebody working very part-time hours. So that's just a side note from a practitioner's point of view. The next thing we have to figure out is whether you've used these months or not. So how do you determine that? Well, one of the ways you can figure out, and it's highly recommended that you access this report, how you can figure out if you've used these months is through something called a Benefits Planning Query, or BPQY. This is a report that you can receive from the Social Security Administration, and it provides information about your disability cash benefits, including family member benefits, if applicable. It will talk about your health insurance you're receiving. It will talk about your scheduled continuing disability reviews, your review cycle, and your actual next scheduled review. It will have information about your representative payee and, of course, work history, including the use of trial work period months. SSA can provide these reports, the BPQIs, to beneficiaries or representative payees and authorized representatives upon request, such as a community work incentive coordinator, or generally, as I will discuss today, a work incentive counselor. While the BPQI is a critical tool in assisting individuals who receive Social Security disability benefits, it should be noted that the information may not always be up to date. It's advisable, again, to have someone who is certified and understands work incentives to review this report with you. From my years of service as a work incentive counselor, I would always critically examine the BPQI to see if the information reflects what the customer has told me about their work history. Sometimes it's necessary to contact the Social Security office to update them on recent work you have on record. That could change information in the BPQI. In either case, whether you have assistance or not, this is the first step in making sure you understand your benefits and your particular use of work incentives. So more specifically, how do you get to one of these reports? Well, we've given you information here about how you yourself can contact Social Security to request a BPQI report. There's a number and hours of operation here for you to access. If someone other than you, the beneficiary, representative payee, or appointed representative, such as a benefits counselor, wishes to receive the report, they do have to submit a consent form that Social Security has in place that they call an SSA 3288. There'll actually be two of these that are going to need to be signed by you, the beneficiary, and the representative. One authorizes the release of the Social Security records, while the other authorizes the release of Internal Revenue Service earnings records, so your work history. And both of those have to be submitted to the local office and contain your Social Security number, as you'll see when you look at these forms. We've given you a link if you're interested. Again, for anyone who's considering the return to work or working for the first time after receiving benefits, I would recommend they obtain a BPQI. Even if you're planning to see a certified work incentive counselor who can access this report with your permission, requesting this in advance yourself, in advance of the meeting, will help you have a very productive initial meeting. And again, remember to review your earnings record carefully. That will be included in this report. Make sure that none of your earnings are missing, with the exception that you may find that certain recent earnings, say within the last few months and even in the last year, may be missing from this report. Always check with the local office if you suspect anything is missing that should be in this report. One of the advantages of working with a certified benefits and work incentive counselor, or a CWIC, a community work incentive coordinator, through the Work Incentive Planning Assistance Project, is the use of this fairly standard report that's called a benefits summary analysis. This slide shows just a snapshot of the beginning of this report, which provides you a detailed summary of your benefits, your work goals, as well as recommendations for the use of various work incentives specific to your situation. This is a customized report that draws from, again, your goals, the BPQI, and recommended work incentives you should consider using based on the knowledge your work incentive counselor will have. This report may also focus on other goals that you have. Maybe self-employment is one of your goals. Maybe you have financial goals. Maybe home ownership is a goal. All of these should be developed in this benefits summary analysis with the assistance of, again, this would be definitely something you would see a CWIC develop. However, often other work incentive counselors use this and or a similar report. I put this up basically because if you request this kind of support, you could ask for this kind of a detailed, customized report about your benefits. So back to work incentives, we talked about the trial work period months, right, and when those are used. We have 9 of those, remember? And we talked about when those end, the extended period of eligibility begins. And this is really the next work incentive available to assist disability beneficiaries in the return to work. Again, after that last trial work period month has been used, this EPE will begin. It's a 36-month period. And unlike the trial work period, remember they didn't have to be consecutive, once the EPE begins, it will end 36 months later, whether you're working or not. So what does this do for you? Well, this is really another protective period for you to help you in the transition to work and protects your eligibility status, not necessarily your monthly cash benefits. Again, this comes back to something that Social Security continues to evaluate ongoing after, but both during eligibility and after, which is that SGA rule we talked about. So during the EPE, if you're earning more than the substantial gainful activity amount, you may not be eligible for cash benefits that month, but even if you aren't, you're still tied to the program. You're still connected based on eligibility, even if cash benefits are removed. You should know this in terms of whether or not you're eligible for benefits that month. I said you may not receive cash benefits, and this will be dependent on additional work incentives you may be using, which we're also going to discuss. So I look at the EPE as another safety net for you, a powerful work incentive. Additional pieces, though, you should understand about this is that after the trial work period and when the EPE begins, when your wages first exceed the SGA level, Social Security will kind of look at that as your cessation month. And when a pattern of earnings exists that show that you're earning gainful levels of employment, SGA level employment, that's how they'll establish not only that first cessation month, but the subsequent 2 months in a package that they'll call a grace period. This 3-month grace period allows you to, again, continue to receive your full cash benefits, even though based on what we told you so far, it should be that they stop benefits. This grace period is another advantage to you if you're trying to return to work. And a slow transition to potential cessation of benefits. Now we talk about cessation, so I think we needed to also sort out termination, which is very different. Termination could only occur after the EPE is complete. How long was that? Remember we talked 3 years. So if a person is earning wages below SGA after the completion of their extended period of eligibility, they'll continue to receive their benefit check as long as they're medically eligible. However, if a person has countable wages, and I'm going to describe that further as we move along, above SGA after the completion of the extended period of eligibility, that's when benefits may terminate. It's definitely more tricky for self-employment because an individual determination of SGA will need to be established at the local office. Your claims rep will look at not only income, which is really what they would call NESE or net earnings from self-employment when they're making an SGA determination, but they can also look at hours that you're working towards your self-employment. Because it's so complex, that's really something I'd recommend that you talk with your local office and work incentive counselor about. Again, the last reminder on this is that the 36-month EPE begins in the month following the 9-month completion of your trial work period. and it will begin whether you're working or not. So that kind of starts and ends within that 3-year period after the conclusion of your trial work period. Now, I'm kind of a visual person, and over the years, I found that it's really difficult. This is a very difficult concept to describe to folks. So often in trainings, this is what I resort to when I talk about all of these work incentives in one snapshot. This is sort of an overview I really like because, again, for those who are more visual, this helps you get sort of a timeline of how all this comes together, which I'd like to just review one more time. So if you are new to benefits and you have not worked since you started receiving benefits, you're not even on this timeline yet. You're sort of at the starting gate. And that starting gate begins with the trial work period, that 9-month period where you can work and earn as much as you want. We talked about, again, how those months count. If you are working and earning more than $770 a month, that's this year's rate, 2014 rate, that'll change next year. That will count as one. So if next month I go to work and I've got all my 9 trial work period months and I earn $1,500 next month, they're going to check off one of those 9 months and say, Kevin, you got 8 months left. You've used 1. So that's what this is for. This is for you to try returning to work to see how you're going to do when you're ready. This is your choice. Again, I want to caution you to use these months wisely. This is really a chance for you to determine how you will do if you're working, more hours than maybe you've been used to because you've probably been out of work for a while. Now, this next part is hard to place on this timeline because it doesn't necessarily have to occur right after the trial work period. But this grace period we talked about, which is a little confusing, that 3-month period really where that Social Security establishes that you've got this pattern of earnings over substantial gainful activity, which, by the way, they can use wage averaging to even help determine if that's the case or not, another benefit for you. But when they do establish that you have this pattern, that first month in the pattern becomes your cessation month. The 2 months following that are part of that 3-month grace period that they provide you, yet another incentive for you and an allowance that keeps you in your full benefits for that period, even when technically, based on the things, again, we talked about, you shouldn't receive benefits for those months. But after that occurs, let's say that occurs right after, we'll keep it very simple for today's example, you have the rest of this 36-month extended period of eligibility at your disposal. This is, another powerful incentive because what they look at here is earnings again, and are your earnings above the SGA level, that substantial gainful activity level. Again, those rates are $1,070, the non-blind rate, and the $1,800 a month for the blind rate. If, as a general rule, if your earnings are over that amount, they could say, okay, for that month, we're not going to pay you. But if they're below that amount, you will get paid. That's a general rule because I really haven't put into play here other work incentives and how they play into the determination Social Security makes about whether you're gainfully employed or not. One thing I know I've forgotten over the years to tell people is that timeline sort of ends there. And a lot of folks will think, well, that's when my benefits end then if I initiate this. And that's not the case. Just because you're outside of the EPE doesn't mean that benefits will end. It's really dependent on earnings, SGA determination, and the use of work incentives, okay? So really, it doesn't mean that just because that's over, that automatically benefits end. But just to review, during the EPE, this is sort of like a safety net. If you're over SGA, it's possible benefits could stop for that month, but you remain tied to the program. You're still connected. It does as it suggests. It protects your eligibility, not necessarily the cash benefit. So again, this is a time period for you to try the return to work. Maybe you're doing well. Maybe during the EPE, you've tried to work more than you thought you might be able to, and you've done it successfully. Maybe you continue that work right into your EPE. And at some point, it is possible benefits could stop. They could cease for a period during the EPE. And you're still seeing how can I do? Well, is this a job that could carry me long term? That's the purpose of this package. It's to help you decide if you're able to maintain this work activity long term. So again, if you work closely with a work incentive counselor that can guide you through this process, this will be a planned event. There won't be surprises. That's what I love about planning with people rather than often in the years of service I would do damage control. That's not really the best place to be, meaning people come in after they're well beyond this and maybe they haven't reported and some of the things they didn't know kind of played against them. That's why it's important for you to have this knowledge today about how your incentives, your work incentives operate and how they can benefit you in the return to work. So I kept saying things like maybe they will stop your benefit during the EPE, maybe they won't, and it's dependent on these countable wages. Well, the next slides will show you, talk about additional work incentives, and I think will help shed some light on this. Again, there are many. We showed you the chart. There's just too many to really discover in such a short time, but the key work incentives we want to talk about today are IRWEs next and subsidies. So impairment-related work expenses. Well, what are these? Well, Social Security recognizes that individuals with disabilities may experience more out-of-pocket expenses related to the return to work than their non-disabled peers. IRWEs allow you to account for these expenses. So in short, an IRWE exists when these three basic ingredients are in play, as you can see in the middle of the slide here. So these three ingredients are basically that you're paying for this item or service out of pocket, the item or service is related to your condition, and if you didn't have this item or service, you wouldn't be able to maintain employment. Okay, so those are the three basic ingredients you should apply to whether or not something is an impairment-related work expense. So what does it do for you if you do have an IRWE? Well, the amount of the approved IRWE will be deducted from your gross wages, leaving what SSA considers countable wages, which is used to determine either continued eligibility and or eligibility for cash benefits. Okay, so this is what plays into these SGA determinations, is if not only how much are your gross wages, but when we look at work incentives and we reduce the work incentives from gross wages, what's left is countable wages. That's what Social Security will look at in making these determinations. Let's look at some examples. Again, there are a number of examples of IRWE, from transportation to attendant care services, expendable medical supplies, and even the cost of service animals, including food license and veterinary services. But for all of these expenses, I want to bring you back to the basic tests of IRWE to decide if it applies. And it really, to me, remains simple in my mind if I apply those three basic ingredients we talked about. And I think what we could do is just apply that to an example. If we apply that to an example of transportation, let's talk about public transportation, for example. Is that an IRWE? I wish I could poll folks today. I'd ask you and see how many folks are getting this concept. But let's talk about public transportation and apply those ingredients. Is it something you pay for out of pocket? Yeah, you would. Is it necessary for employment? Well, sure. Yeah, it's getting you to employment. Lastly, is it related to your condition? Well, no. We'd have to say no there. So public transportation really wouldn't count as an IRWE. However, paratransit services, which require the parallel route to public transportation, does require that you have a disability to be eligible. So if we applied those three ingredients again, yes, you're paying for that service out of pocket. It's certainly necessary for employment if that's what you're using to get to work. And is it related to your condition? In this case of paratransit, you could say yes. So there's a transportation option that would count as an IRWE. If you're confused again about this is why I keep referring you back to find your local work incentive counselor to walk you through this. But in terms of a webinar platform, the only way I could think to really describe how does this impact SGA level employment is to give you an example. So John is our example today who's working, and he's earning in this example $1,200 gross per month in wages. And he's currently in his extended period of eligibility. Now remember, if he's in an extended period of eligibility and he's at $1,200, right, should he be getting his benefits? That's a flag, right? This is one reason we would look at IRWE in this case. And in this case, John has some out-of-pocket expenses related to his disability, and his ability to continue working as follows. He has a $150 per month expense for paratransit transportation services, that alternate mode of public transportation services, which I set up in the last slide to take us into this example. So if we looked at how Social Security would look at John's wages that month, well, they'd look at his gross wages of $1,200, which raises that flag, right? Now we were like, okay, that's more than the SGA amount we talked about. That's a problem. But now we get to deduct the IRWE in this example of $150 a month. What's remaining is what Social Security calls countable wages. So now $1,050 in countable wages is just under that SGA amount. Remember the SGA amount? And I should have put it up here to remind you, $1,070 in this case, because John is not blind. So his SGA level would be $1,070. So his countable wages are just under the wire now of SGA, therefore allowing him to get his cash benefit that month, even though without IRWE, he would not be able to. Let's look at another work incentive and how this plays out. Something called subsidy. And I must say, of all the work incentives, I think this is the most misunderstood and confusing. But subsidies allow Social Security to deduct the value of extra supports you receive at no cost, meaning you're not paying for it necessarily. It just exists. A subsidy may exist when an employer, for example, provides some of these things, such as maybe an accommodation or a support, a specific support, or maybe extra supervision that somebody needs to get started. Maybe they customize a job to meet your needs. Could also be considered an accommodation, but that's a little different. Maybe they allow for a lower productivity for you versus somebody else who doesn't have a disability who has the same job title and the same wage. That's one example. Another example is an agency or an employment agency providing supports, which would also be called special conditions. This is when an employment agency assists with some of the following things. Maybe they assist you in securing employment, so they're helping you with your job search. Maybe they provide you with an accommodation you need on the job. Maybe they support you in getting to work. Or maybe they provide you on-the-job supports, something we might think of as a job coach. So these are examples. I put a note here that subsidies apply only to SSDI and are used during the initial, can be used during the initial eligibility process, as well as when an individual is working and earning income. So we kind of identified what they are, where they exist, but to summarize, subsidies, again, allow Social Security to place a value on the supports you receive on the job, even though you aren't paying for them, such as those exceptions, for example, an employer is making for you, which can be deducted from gross wages. That's the purpose, which leaves countable wages. Again, let's talk about SGA. Those determinations are being made based on countable wages. So if countable wages are less than SGA, you will remain eligible for your cash benefits. I should put a side note here. Is it the goal to always remain connected to benefits? Not always. Again, I think these work incentives really become a bridge, a necessary bridge to employment. If your goal is full self-sufficiency, this is a great bridge to that goal of self-sufficiency. It may not be everybody's goal. It may not be that people can all go there. We understand that. But if you're able, these incentives can really support your journey. Here's another example because, again, I think the only way to really play this out and show you how this works if you're not familiar with these systems is to give you a practical example. And actually, this is a practical example that jogs my memory because this is one that I helped to put in place years ago. We'll call this person Jake, who works for a restaurant, making $1,260 a month, and he's well-liked by his employer. He has some physical limitations that prevent him from lifting the grills that are cleaned daily, and one of his coworkers handles this task daily instead of Jake. While that's a normal part of his job requirements, the employer has accommodated Jake by having another employee take on this task. Jake is also allowed to arrive later than normal as a family member drives him to work since he can't drive, and public transportation was not an option in this case. Other things you need to know based on the things we've learned so far is that Jake has used his trial work period months and his grace period has been established. He's midway through his extended period of eligibility. Now, my goal isn't to make you all experts today in this, but to give you this sense that, okay, we know that if he's in his EPE and he's over that SGA limit, his gross wages are, right? Then based on that and what we've talked about so far, he wouldn't be eligible for these cash benefits. He should be in cessation, right? If you're nodding your head, yes, you are correct. He should be. But let's examine how subsidy can change the rules. Social Security uses a form called a Work Activity Questionnaire that evaluates the percentage of work that the employer subsidizes. And again, this is kind of a confusing concept, I think, for an employer to look at. I actually pulled this right from the Work Activity Questionnaire, this chart that kind of looks at some of these areas that Social Security hones in on when we look at, are there subsidized wages involved? You can see I checked off a couple here because based on the example of Jake, which we'll follow through, we could easily say that because he's getting some assistance, maybe he gets fewer or easier duties, right? Not that there's anything wrong with that. The employer is happy to accommodate him. But these things exist, and they can be accounted for through subsidy. The other thing that I checked off here based on this example is special transportation. Remember, he's not paying for these things. They just exist. They're supports that exist that Social Security wants to honor. Because if they didn't exist in another job, maybe Jake wouldn't be working at this level in this example. So using these categories really does help an employer to determine Jake's productivity compared to his non-disabled coworkers in similar positions. And Social Security will deduct this amount from Jake's gross wage to evaluate whether he's gainfully employed. We'll deduct what amount? How does Social Security determine the value of Jake's subsidy? Well, they actually look at a percentage when evaluating subsidy, which I didn't show you, but that's further on this form. So in this example, let's say using these 10 categories which are in the form as a guide, an employer might check off the percentage they feel represents Jake's situation by looking at, well, there's 2 of these categories we feel we help with out of 10, I suppose, and this is not a written rule by any means, but I suppose there's a certain logic that an employer could use, and often I've seen them use, that say, well, I checked off 2. I'm going to say in this case, there's a 20% subsidy based on the supports he receives. So now we can see how this plays out in a practical way. So again, in Jake's case, let's say it was determined that a 20% subsidy exists. Here's how Social Security would look at his earnings. I'll go back to what his monthly gross wages were, $1,260. Remember, that kind of raises a flag. Certainly if you're a work incentive counselor, that raises a flag or a CWIC, and that's why you might look at one of these work incentives to support somebody. So let's look at how subsidy plays in. We know that it was a 20% subsidy. So what Social Security can now do is take that $1,260 and subtract 20%, which actually has a value in this example of $252. When we subtract that, what's left is Jake's countable wage of $1,008. Since the countable wages are less than SGA, well, guess what? Jake, again, is eligible for cash benefits that month. And here's a basic rule of thumb for work incentives that I want you to understand today. Gross wages minus work incentives equals countable wages. And remember, SSA makes determinations after the trial work period based on countable wages. Having, again, a work incentive counselor, a CWIC involved in this process and in explaining the purpose of subsidy will help immensely. Because if Social Security just sends this to an employer, often the employer will err on the side of protecting their employee by not indicating all the supports that exist. Yes, I've seen this time and time again. An employer may say these things don't exist because they don't want to make the person look bad in their eyes. So having that work incentive counselor there to help an employer understand what the real purpose of subsidy is and that it's okay that you're accommodating somebody. In fact, Social Security is honoring that employer's willingness to accommodate you through a subsidy. That's really what the purpose is. So again, that work incentive counselor can really help that employer better understand the process and the purpose of a subsidy and work incentives in general. In terms of reporting, well, we've kind of developed a list here of things that you should do. And as a reminder, IRWE and Subsidy are used to reduce countable income for disability beneficiaries, okay? And yes, I've told you probably too many times at this point that we recommend that you work with a certified benefits and work incentive counselor just to make sure you're being protected and that all the incentives that are available to you individually are being considered. Either of these incentives will need to be reported to your local field office, though, whether it's you doing it or somebody else. And evidence will need to be submitted along with regular reporting of your paycheck stubs. With IRWE, you'll also probably need to keep receipts on hand to tally the costs of those IRWEs. And those generally are submitted monthly, but I recommend that you get on a schedule with your local office and talk to your claims adjuster, your representative. And Subsidy is different. Documentation will be needed from the employer. I already showed you the form that's actually the form that would be used, or parts of it. So that would have to be developed with the employer. And that's one of the few times a CWIC or work incentive counselor would actually get involved on the job site. So, there's obviously, your approval would need to be there for that to happen, because it's basically disclosing. So I put that out there because if you do get somebody that helps you, or they mail that directly to the employer, in either case, it's really a form of disclosure. So again, your disability claims representative will review your earnings and work incentives, and if approved, they're going to adjust your SGA determination accordingly. So remember, all these incentives come back to adjusting how Social Security looks at your wages to reduce gross wages to look at countable wages for SGA determinations. The individual should discuss with their claims rep the frequency which they want this information. Again, generally it's monthly with IRWE expenses. And I put a very important note here about Subsidy, is that these determinations remain in place as long as the person remains at the same employer. I have to confess, whenever possible, I would look at these because I wasn't a fan of people having to submit paperwork ongoing. And so if these things existed, it was a one-time deal. Once these were, the subsidy was established and in place, the person was protected for as long as they remained at that employer at the level that we determined. And finally, the individual should continue to report wages monthly and maintain documentation of all your IRWE expenses. Wage reporting is critical. Other important pieces you should be aware of is that when you return to work, many folks are concerned about the loss of their medical insurance, and rightfully so. But the good news is that if you're a disability beneficiary, you're entitled to continued Medicare coverage both during the trial work period and for at least 93 months following the conclusion of your trial work period months. During this entire period, your hospital coverage, that's the Part A, is automatic and cost-free. Your outpatient coverage, that's the Part B, continues to be an option, but that will be subject to premium payments. This year, those premiums will be $104.90 per month. So in short, this means that if you go back to work, you can keep Medicare insurance for at least 102 months. I think that's good news. I think that definitely encourages folks who are thinking about the return to work. And I will say that often beneficiaries that return to work access employer-sponsored plans. So you can see that this time frame allows for this transition. Additionally, when working, you may be eligible for expanded Medicaid coverage on top of potentially employer-sponsored coverage and Medicare, which we'll also review before we conclude today, what that means about Medicaid expanded coverage. I mentioned up front that EXR is one of the most important new work incentives that I think you should be aware of. Because often in the past when I would talk to people about returning to work, they would say, Kevin, that sounds great. We think this is fine and dandy, but what happens if we try these things you suggest and then something happens after we get terminated? Well, there is now an answer to that dilemma, and that's an expedited reinstatement of benefits, or EXR period. The EXR provides, again, a significant level of protection to you, a disability beneficiary who's returning to work and who have their benefits terminated due to gainful work activity. Remember, termination would occur after the extended period of eligibility. So we're talking, if you're at that starting gate we talked about, way down the line, that this might be needed in your case. But it's a nice ace to have up our sleeve if needed. And another important note that I keep making is that when you are receiving proper benefits and work incentive advisement, benefits termination is a planned event. I used to kid with folks all the time at training events where I would talk to folks about these work incentives and say I have successfully helped a number of people lose their benefits. And it's successful if it's planned and it's not a surprise, and it can be. And that's why I want you in front of somebody who understands these incentives. So who's eligible for this EXR? Well, disability beneficiaries can be reinstated without a new application if the person was eligible for disability and lost disability due to performance of substantial gainful activity, and request EXR within the consecutive 60-month period beginning with the month of entitlement termination. Well, that sounds like Social Security jargon if I've ever heard it. I'm sure it does to you too. So basically, if somebody goes back to work and they've gone beyond the extended period of eligibility, and even with work incentives in play or not, if that happens to be the case, someone is terminated because they're doing well and all is as planned. Somebody tries to work, they're doing well through the trial work period, they find that they can return to work, they continue to work, let's say. And the EPE will eventually end. We talked about that 3-year period. And now we're beyond that, and let's say something happens and it prevents the person from continuing to work because of their disabling condition. Well, in short, even if you're terminated due to gainful employment, remember you have this 60-month window from the month that you're terminated to request reinstatement if you can no longer perform SGA level work activity. I look at this as sort of a backdoor to the Social Security eligibility process. It's very different than an initial claim. It gives you a lot more leverage as a previous beneficiary who tried returning to work. Another important point that I should have put on this slide for you today, but you should be aware of, is that if you use EXR, you will receive 6 months of provisional benefits while you wait for Social Security to decide if you still have a disability under their rules. That's incredible. So certainly not, this is not something provided or afforded to anybody during application, right? But if you need EXR while they're deciding if they should approve your claim based on having to stop work because of your condition, rearing its ugly head again, you can get these 6 months of provisional benefits. So that's pretty incredible. Which some may say, well, what happens if I'm denied? Do I have to pay those back? And the answer is no, you would not. So that's EXR. So if all fails after all of these incentives are applied and things are going great and then something happens, we still have this ACE that we can use that I like to think of as your expedited reinstatement of benefits. Lastly, I want to talk about wage reporting and why this is so important and how Social Security looks at your wages if you receive Social Security disability insurance benefits. So what's interesting for SSDI beneficiaries is that Social Security counts your wages when they are earned. This means you should not count wages in a month based on the date of your paycheck, but rather look at the month the wages were earned. I'm going to show you on this next slide how you can track this and how this works. It's actually not that complicated. Yes, I probably should update my calendars here, but the point is the same. I'm using this example of Joe who earns $600, which is not a lot, but the math was simple. In a 2-week period, we're going to say he's paid biweekly. And so you can see in this example, he's paid on the 2nd of that September, and it's for a 2-week period. And so how do you break this down? Well, Social Security would simply develop a day rate. Since he's paid biweekly, we know in this example there's 10 paid days in that pay period. So 600 divided by 10 gets us the day rate of $60 per day. Then you would simply look at the days in the month and apply the day rate. So in this example, 8 days in August would be applied at that day rate of $60 per day, so 480 would count in August and 120 in September. Why is this so important? You may wonder. Well, we talked about the use of trial work and so forth and EPE and SGA determinations. Well, all this matters because Social Security looks at your wages each month to make certain determinations. So it's important that we look at the wages properly in those months. And sometimes a work incentive counselor or CWIC will actually assist in correcting decisions that were made based on Social Security, maybe not having all the information they needed to make that decision correctly. And I would be remiss if I didn't talk about your responsibilities when returning to work, because I assume many of the folks on the line today are considering that option, which is why you wanted to hear about these incentives. So in short, you should report new work activity always to your local Social Security field office. And basically, I'd develop a letter that includes the following fields, and make sure your work incentive advisor receives a copy of this letter as well. Make sure the letter includes the name of the employer, the hours per week and average wage you'll be making, date you started, and of course your Social Security number. You should provide wage data to Social Security monthly by providing a copy of your paycheck stubs. I put a note here, keep your originals. In either case, keep a copy on hand in a folder. Wage data can be faxed, hand-delivered, or mailed, and there are other methods now today too for certain beneficiaries. Remember to write your Social Security number on your paycheck stub. Often people forget this, and they have a special file where they put those paycheck stubs, a circular file, because they won't know who to attach those to, because none of our paycheck stubs have our complete Social Security number on them. So, and of course, make sure your name, if it's not already printed, that may already be printed on it. If it's not, make sure it is. Why am I making sure that you understand this? Because one of the primary purposes of timely wage reporting is to protect you, the beneficiary. Timely reporting can help prevent overpayments on your record. Because if Social Security is not aware of your earnings, they won't be making some of the determinations that they should be making based on gainful employment. So while I know that often over the years when I've consulted with folks, maybe they would say, I'm not going to let them know, or they're concerned about that. I would always redirect folks, because often when people don't, eventually IRS provides earning records to Social Security, so eventually they find out you're working anyway. And I'm sure that's most people's intent is, how do I do this correctly? And so that's why I'm telling you this today. If you do this correctly, it can help to prevent overpayments. I will say also, should overpayments occur, because sometimes people are good and timely reporters, but still overpayments occur, well, then this can be helpful evidence down the road, if needed, to say, well, Jane did or Joe did report timely, and as a work incentive counselor, there's ways to support you if that's the case. So that's a basic overview of Social Security disability, and we didn't want to ignore SSI. But unfortunately, because of the complexity of all these incentives, you could see that it does take time to review just the one program. But we wanted you to know, if you receive SSI, there is more information about the SSI benefits and work incentives associated with that program if you review this archive link. And we gave a little description here and a link that you can check out if that happens to be the benefit that you receive. So this is great news. There's lots of information about work incentives, and I hope that this shows you that it's possible, if it's your time to try the return to work, it's possible through the use of work incentives, if you're working with somebody who truly understands how to leverage these work incentives for you, to make this journey. So you may say, well, I need additional supports. I am concerned about that health insurance, and so what we want to do is kind of review additional employment supports that you could access on your journey, one of which is this expanded Medicaid coverage. So in general, eligibility for Medicaid will vary by state, which is why we've provided you a link in this slide to review Medicaid options in your state. Generally, Medicaid buy-in expands Medicaid coverage to those with much higher income guidelines for those individuals with disabilities who are working. And it is attached to a disability. So this is a true, in this case, state work incentive, and a very powerful one, in fact. But basically, this provides this additional coverage of Medicaid. Basic criteria we can safely talk about today are that this would apply to folks between the ages of 16 and 65, someone with a permanent disability, basically using Social Security's criteria, somebody who's employed, Okay, that's what makes this a work incentive, and somebody that meets the income and asset guidelines. Again, the income guidelines in most states are very generous for Medicaid buy-in programs. So, again, you don't have to be the expert today, but make notes of some of these things you want to explore further and discuss with an advisor. And how do you get to one of those folks? Well, benefits and work incentive advisement has been a passion of mine for years, if you can't tell. And we want to make sure that you're connected to a work incentive planning assistance project near you, because they can do lots of things to support you in your decision to work, in effective employment strategies, and the use of work incentives and all the things we talked about today. And they provide services to folks who receive disability or SSI between the ages of 14 and 65 to their parents and guardians, service providers, and other supporters. There's a link here that you can go to find a provider by state. And I would highly recommend you do that. I did put another note here that many states have developed what they call work incentive networks. And this is really an effort, a great effort by many states to train professionals to better understand Social Security disability benefits and work incentives. Now, I wish there was a repository that lists every state, and I really couldn't find one for you. But if you were to simply Google work incentive networks, that might be an additional resource to you. It's not that I don't think you should access your work incentive planning assistance project, but if somebody isn't available or if they're not available readily, this is an additional resource I wanted you to be aware of so that you can get connected to some support. Protection and advocacy helps beneficiaries with legal matters that may arise in the return to work. And they can do a number of things to assist you, and this is at no cost to you, such as access to community services and so forth, transportation, disability benefits, and work incentives. So there's a link here on this slide, and if that's the kind of support that you need, again, this state-by-state directory will get you directly to a PABS project near you. Ticket to Work is a program that actually I've been involved with for many years. It's a great work support for folks that receive either SSDI or SSI who want to go to work. Generally speaking, the ticket program was created as an alternative to our state VR program, which we'll talk about in the next slide. But what it basically does is it increases the choices you as a beneficiary have in receiving supports in the return to work. It also, I mentioned earlier, can suspend your diary date continuing disability reviews when you activate your ticket, and as long as you're making what they call timely progress. Of course, any employment network that you could look to, and there's a locator at the bottom. That link at the bottom is also a state-by-state directory that can direct you to an employment network near you if you think that's the right support for you. I would also recommend that you look at the employment networks available and make sure that the employment network you choose can provide benefits and work incentive advisement to you, or has a connection to a provider that can assist you with this information. So these folks are contractors of Social Security who are qualified, by the way, to provide these services to you. VR offices, by the way, our state vocational rehabilitation offices, are employment networks by default. But this is an alternative to VR. Now, of course, we would be remiss if we didn't talk about our state vocational rehabilitation programs. They are the heartbeat of helping most folks who experience barrier or disability to return to work. And this is a state-federal partnership that promotes employment of folks with disabilities. VR counselors do have extensive and specialized training to work with you, which is important for you to understand. And they will help you identify employment goals and provide assessments to measure your skills and aptitude. Certainly, I've seen often is the case that VR will help people determine interests they didn't even know they had. Maybe they have to stop doing what they used to do, and working with a counselor can really help you evaluate possibilities for your next steps. So again, here's a link for you to reach out to a state VR program near you. We also should point out the Department of Labor has American Job Centers across the country, operated under the Workforce Investment Act of 1998, which interestingly will be shifting as the Workforce Innovation and Opportunity Act was signed into law recently, July 22nd of this year, which reaffirms the ongoing role of American Job Centers, meaning they'll continue to be there to support you, and you should access AJCs in your area. They may be just a part of the process of supporting you in the return to work and not the entire or the primary provider, but some cases, many of our AJCs today have become employment networks. So just take a peek and see which AJC is near you and see what kind of services they have to offer. Often their websites will have a lot of this information you can check out right online. Independent living centers are also an important resource for you in the return to work, and Centers for Independent Living are grassroots advocacy-driven organizations and have these 4 core services: individual and systems advocacy, information and referral, peer supports, and independent living skills training. And there's a link that will help you identify an independent living center near you. There's been a lot going on in recent years in terms of federal hiring of people with disabilities, lots of exciting changes. And the federal government does provide employment opportunities for individuals with disabilities using something called Schedule A hiring. We could do a whole training on Schedule A hiring. If you're not familiar with that, you've not used that to your advantage in terms of looking for job openings that you might qualify for, you certainly should. There's a couple links that we've provided you to learn more about Schedule A hiring, because we won't have time to get into details about that today. And with that, I think we really should talk about some suggested next steps that we have for you. And I think what I'll do now is turn it back to my colleague, Elizabeth Jennings.
Well, thank you, Kevin. That was really a beautiful job on making all of this very complicated information a little bit more user-friendly. I know that some of you on the line may have some cognitive challenges related to your MS, and please know that we've already posted the slides online. If you sent me an email during the webinar to get the slides, they were sent to you as well. And just remember that we're here to provide you with answers to the questions you may have as you review these materials by yourself or with your supports, or as you go to connect with benefit planners. So as some suggested next steps, we'd really like to encourage you to do just that, but also to look at registering with one of the employment supports noted. Hopefully today advised you of the room that you have to work if you feel that you're able to. And so we hope that you'll explore some of the employment support programs that Kevin talked about. We'd also really encourage you to meet with a benefits planner so that you can make an informed choice about returning to work. Today gave you, a nugget of information, just enough to let you know that there is some room to work, but certainly fully utilizing the work incentives can take some savvy, and fully understanding the impact on your individual benefits, meaning where you are in the trial work period, where you are in the first 12 months of eligibility, things like that, so that you can have a very clear idea of what your next steps would be. So we hope you'll go and meet with a benefits planner. We also hope you'll review some of the previous financial wellness webinars and determine an earnings goal, and you can link to those through the website we've provided. And then we'd love you to set a goal to complete items 1, 2, and 3 over the next few months. Maybe it's something that you decide you'll do before the end of this year or as part of your resolution for next year. And we'll reach out to you to see how you did, and we hope you'll share your experience with us. So, Kevin, we got in a lot of questions, and I know we have limited time to answer, so I'm going to pick out some of the questions that came in repeatedly so that people can get those kind of hot-button issues answered. So I first want to make sure everyone on the line is very clear. We were only speaking about Social Security Disability Insurance, or SSDI, today. If you have questions about SSI or you need more information about SSI, there are links to that on the Financial Wellness Webinar Series site on our website. And Nakia, if you could just one more time give them the link to that portion of the website so folks can link to the archive webinars. But Kevin, one of the questions is, I'm confused. Don't you subtract $60 for earned income and $20 for unearned income when figuring out how much I earned?
Yeah, I can understand the confusion, Elizabeth. To whoever asked that question, that really pertains to the Supplemental Security Income benefit, not to SSDI. So, you know, that would cause confusion. So we didn't talk really about SSI today. You'd have to be here another hour and a half, and we certainly wouldn't keep folks for that long to talk about SSI on top of all the things we talked about with disability. So that's the answer, is that doesn't apply to disability. That has to do with the SSI benefit.
Another question is, does the EPE, the extended period of eligibility, start right after the trial work period ends, no matter whether or not you are working?
Oh, that's good. Yeah. So I'm glad whoever asked that got that point, and that to affirm, yes, you are correct. That's exactly how it happens. So when that last or 9th trial work period month has been used, the next month, whatever that is the first month of your extended period of eligibility, whether you're working or not. And you probably noted that throughout today's presentation, I kept saying, get with somebody to help you get some planning around this, because it's important that you look at these stages of your work incentive and plan it out accordingly. Otherwise, it could get away from you. Maybe you'd end and, you know, it wasn't good timing, you had to stop working, but yet that EPE begins. And I'd hate to see that happen. So make sure you get in front of somebody to help with this planning.
Another question is, how long does it typically take for a BPQY to arrive after it's requested?
Wow, I think that's a loaded question, Elizabeth. Well, I say that because it really depends, and I say that a lot about Social Security disability benefits. It depends, that is. It depends on the office. It depends on the volume. You know, if it's a small office and you're working with a CWIC, for example, that has a great relationship already established at that office, they may get it in a couple days. I've heard of a BPQI taking a couple months. I really don't have a standard to put out there to you, but I would say, you know, if you're going to work with somebody, whether or not you're going to work with somebody, you should get that report, and you should ask for it well before you think you might need it. So I hope this encourages folks today that have been on the line to kind of, you know, look at their benefits in that way and ask for that report from their local office. But unfortunately, I can't tell you exactly how long that should take.
Thanks, Kevin. Another question is, can you please explain when the numbers change?
The numbers will change each January at the beginning of the year, and in December, we generally see a sort of a fact sheet that Social Security puts out that will talk about next year's numbers. So if you want to know in advance of 2015, what will those numbers look like? Well, then be watching in December of this year when that fact sheet from Social Security comes out. And if you just jot that down, you could simply Google that and find that easily too, but that's when you should be looking for those numbers.
Thanks, Kevin. I have to say, everyone on the line asked really great questions, and so if you can manage it, Kevin, we're going to fill up the last 2 minutes with a few more.
Sure.
So another question is, what happens when you get 3 paychecks in a month?
Well, that's an excellent question. And, you know, I put that piece in about wages and how they're counted for disability for this reason. Remember, we're looking at when wages were earned for disability, not the date of the paycheck. So whether you had 4 paychecks or 6 paychecks, it really wouldn't matter. What we have to look at is, for disability, when were the wages earned? Now, if we were to go down the path of talking about SSI and how Social Security looks at wages for SSI, it would look different. So I want to be clear. Elizabeth mentioned it. I'm going to mention it again. What we talked about today really applies to Social Security disability insurance benefits. So to answer that question clearly, it doesn't matter how many paychecks you receive in a month. What matters is when the wages were earned. How do you figure that out? You figure out that day rate that I showed you, and then apply that day rate to the number of days in each relevant month. I hope that helps. And if there's more questions, which I'm sure there are, make sure you reach out to a work incentive counselor, a CWIC, or us here at NDI.
Sorry, I was on mute there for a second. Thanks, Kevin. So another question that people had is they're kind of, some people have had a not great experience with ENs, and they're wondering how they determine who they're going to work with.
You know, I appreciate that somebody asked that. I know it's difficult. You know, I did read some things in the chat, too. I really appreciate some of the comments people made in the chat. I also appreciate how difficult it is to keep all this information together. So know that this is available to you after today's webinar, and feel free to review it. But the other thing I would say is that I know there have been some guides put out about how to choose an employment network. Frankly, if I was in your shoes trying to figure out which employment network to work with, I would ask them questions. I would almost act like it's an interview of them. You know, what do you do? You know, how do you support my job search? Do you have work incentive counselors on staff? Or can you get me in front of one? What kind of supports do you have in terms of my job placement? Do you have connections with the AJCs? Is there partnerships that you use? I believe at one point Cornell University put out a great product that helps people consider how to choose an employment network. And I wish I had put that link in there. So if you did a little search on that, how to choose an employment network, I'm sure that you'll stumble across that document, which I thought they did a great job with. So just remember, you know, it's your choice. It's your choice to return to work, and it's your choice who you work with. So don't be afraid to ask the questions that should be important to you in this process.
And with that great final comment, Kevin, we're up. Our time is up for today. If you had a question that wasn't answered, you're going to get a request to do a survey at the end of the webinar. So please feel free to put in the comment box your question so that we have it right in line with your email address, and we'll be sure to email back to you. You can also send it to myself or Kevin, and let me here's our contact information. I want to say thank you again to our sponsors, Accorda Therapeutics, and also let all of you on the line know that we are going to launch a new initiative for individuals with MS that will offer you a free online platform to create your own circle of support. The platform will have, think of Facebook, but with really amped up security, including a vault where you can keep sensitive documents. It'll be free for your use and something that we hope will be of great use to you. If you're interested right now and want to email me for more information, please feel free to do so. Or otherwise, stay tuned. We'll keep sharing information about it with you, and we'll be sure to include you. As long as you sign up on our listserv, we'll be sure to send the information out to you. Thank you again to my colleague Kevin Nickerson and to Nakia Matthews. Great job on the webinar platform today, and thank you to all of you for joining us. We hope to see you again actually in next month in November for our next webinar in the MS Financial Wellness webinar series. Thank you, everyone. Have a great day.